Identity theft has spawned a vicious new kind of crime, medical identity theft. Thieves steal your personal information to line their own pockets with fraudulent claims against your own health policy. Medical ID theft can cost you thousands of dollars, constant stress, and even threaten your life and health. Unless you check your medical records closely, you may discover you were defrauded only after the damage has been done. We'll discuss medical ID theft on today's Weekend Connection. Our guest again today is Eva Velasquez, president of the Identity Theft Resource Center. ITRC is a nonprofit national organization dedicated exclusively to the understanding of identity theft and its related issues. Eva, thank you for joining us again for another edition of Weekend Connection today.
Thank you for having me. I'm so glad that you're paying attention to this important topic.
It is important for consumers to recognize that identity theft is not just a financial crime. This crime varies widely and can impact us in many other ways: criminal identity theft, governmental identity theft, and then, of course, medical identity theft, which we're going to be talking about today. It's a significant and growing problem in the U.S. healthcare industry. And Eva, just how huge of a problem are we talking about?
Well, while medical identity theft does remain a smaller percentage than financial identity theft, it still affected 1.85 million consumers. And when you look at the numbers, they vary depending on the study that you're looking at, but a study by Ponemon indicated that the economic impact is $40 billion a year.
And Eva, I have heard that some hospitals hesitate to authenticate patients' identity lest it be viewed as a violation of privacy rights. Do you think this is widespread?
I really don't think it's that widespread because they definitely face more issues when they don't. And it's generally an issue of employee training and a lack of understanding, as well as a different focus. When you consider an emergency room, the primary focus is often to get life-threateningly ill patients out of distress. Making this, even though it's a big issue with identity theft, it still makes this a lesser issue. And again, what organizations such as mine need to do is make sure that hospitals continue to recognize that they do have a responsibility in ensuring that they're identifying the individuals that they're providing care to. And I ask consumers, again, get involved in the dialogue. If you're going into your hospital or healthcare provider and they're not asking you to authenticate your identity, ask them why. What practices have they put in place? We're starting to see a lot of biometrics in the healthcare industry, which we definitely support. We think that's great. You know, your thumbprint, your palm, a screening of your palm print and things of that nature. And so the medical community is getting involved in finding ways to authenticate patients' identity that isn't extremely invasive.
Speaking of the medical community, is there a legitimate concern that some medical ID thieves are actually doctors or other medical personnel?
Unfortunately, this concern is legitimate. Employee theft, insider theft of information is, I won't say it's running rampant, but it's certainly present. And it's present in all industries. The medical community is not an exception. So there are data breaches and thefts of this information. Most of the medical providers have divisions of investigators that look into these issues. So it is a concern. It's really not one that most consumers can do anything about. It's one of those things where you can certainly ask organizations such as mine to continue to ask the medical providers to educate their employees about the proper handling of confidential information, and you can ask them what safeguards they have in place, especially when it comes to limiting that access to only the employees that absolutely must have it. And the other thing that we are really pitching to the medical community is they need to have policies in place to immediately discontinue access to terminated employees. That, unfortunately, has come back a couple of times where there's been a falling out, employee's been terminated. Access to the information, isn't terminated immediately. Maybe it takes 24 hours. That's a long time to leave somebody who's got a grudge access to that information.
Our guest today is Eva Velasquez, president of the Identity Theft Resource Center. ITRC provides victim and consumer support as well as public education. Now, suppose I am a victim of medical ID theft. Is there the danger of losing my health coverage or face higher premiums?
Unfortunately, there is, and it really depends on the data discovery, how far along in the theft the perpetrator is when the victim finds out. We have had instances where we have people calling into our call center who have received a notice that they, will no longer be covered. So they've lost their health care coverage because they've either maxed out or there's something else going on where the thief has stolen and gone over the allotted amount of coverage and copays. Often it can be resolved. However, it can take several months to get the damage cleaned up, where this individual may not have health care coverage for that time period. And of course, it's just like with any type of insurance. If there's a consistent claims being made on the policy, you can absolutely face higher premiums. This is one of those places where you can do everything right and still be victimized, and it is something that we are working on and trying to find ways to protect people who are victims from having things like the denial of health coverage or increased premiums.
Where everyone has medical records, so are there ways one can escape the scourge of medical ID theft?
It's very similar to the ways that you can mitigate your risk. Now, you can't escape it completely. Again, I go back to you can do everything right and still become a victim, just as you can in any other real-world scenario. But there are a few things that you can do that will help to minimize the risk, and one of them is just being aware. Those explanation of benefit statements that we get in the mail, unfortunately, we're so busy in our lives and we're so inundated with things that as soon as you get one of those statements, and a lot of people don't even know what they're called. It's the one that has the title that often says, "This is not a bill." And so we look at that and go, okay, yeah, it's from my insurance company. I don't owe any money. I'm shuffling that off, and I'm going to pay attention to the rest of the things going on in my life. It's really important to read those statements and make sure that it's from a healthcare provider that you use for services that you actually received. So even though you're not getting a bill, if someone has gained access to your insurance information and is pretending to be you and getting those services, if you get an explanation of benefits for, emergency room services in Arizona and you live in Florida and you haven't been visiting Arizona, that is a big red flag for you to contact your insurance company. Some of the other ways that you can minimize your risk. If you're asked numerous times for information like your medical record or your social security number on forms, ask the medical provider if you are required to provide it. And if you are, ask them what they're doing to protect it. How are they securing that information? If it's on a paper form, are they locking these files? What employees have access? Do they limit that at all? And then you have to make a decision. Have you had those questions, those concerns addressed adequately? Are you going to use that provider? And lastly, we all know if you have your purse or wallet stolen, you immediately think of your cash and your credit cards. If you have your insurance card in your wallet or any of that medical information, don't forget to contact your medical provider and insurance company and let them know that it's been stolen. Also, if you are a victim and you find out that your information has been compromised and used, share it with your family, because if you have mixed medical records, you want your family to know in case you're in an emergency situation where you can't articulate that yourself. You want your family to be able to tell the hospital and doctors.
And we're talking about our wallet and things that we carry around with us. Is there a reason why someone would need to carry around their Social Security card or their Medicare card?
There are going to be, limited times when you will absolutely need your original Social Security card for some reason, or your Medicare or your insurance card. When you know you're going to need them, put them in your purse or wallet, take care of business, and then take it back out. Don't forget to remove it. Most of the time, you really don't need to carry your insurance card. So it's not like if you don't have that card, you're not going to get the services you need to help save your life.
Right.
And then after that happens, then you can have a family member, bring the card, and just make sure you keep it in a secure location, like a lockbox or a locked file cabinet or something like that.
We're talking to Eva Velasquez, president of the Identity Theft Resource Center, concerning medical ID theft. The ITRC advises governmental agencies, legislators, law enforcement, and businesses about the evolving and growing problem of identity theft. Is there a danger, Eva, if I share my health plan information with someone who offers free health services or products?
I would say better safe than sorry in this instance. We use a lot of the sort of red light, yellow light, green light philosophy when we're talking about different information sharing, and I would call this one a yellow light. There could be legitimate reasons why you could be getting what you think are free services, and it could be that your hospital or your medical provider has some kind of contract with a third-party vendor where they're paying for them, especially now with preventative care. I will say the medical community is trying to be very innovative there. So if you start getting solicitations and they're asking for information, before you share any of that confidential information, really do your homework and understand who it is that's asking, what their relationship is, and kind of what they're getting out of it. And then you can make the choice. Yes, this is a service that I want. Okay, they have a good reputation. They have some kind of partnership with my current medical provider. If you get an email in your email that says you can get all these great free services and you don't have to pay for them, just click on this link, I would run the other way. Absolutely don't do something like that.
Now, Eva, I have been on a particular prescription for many years, and I would just take the old bottle and either throw it in the trash or in the recycle bin. And until I went to your website and found out how dangerous that is and that we need to take care of that label on the bottle, that's what I was doing, and I have been doing for many, many years.
And people really don't think about it. You can't recycle that particular type of plastic. If they're less than 6 ounces, you can't recycle the plastic, which is a shame. But I wouldn't go to the site of paranoia and store these things in your house and never get rid of them. But most of them you can peel the label off. I would peel it off, or you can even scratch the important information off before you throw them away. And there are actually a lot of handy ideas that people have with just to be a little bit more green and conscious of the planet of ways to recycle them. You can use them for, buttons, needles, or crafting. You can use them to organize your workbench. So as long as you get that confidential information off of there, that's the important thing to remember.
Absolutely. And Eva, as we close today, if there is one who is listening to our discussion and believe they are a victim of medical identity theft, or they want to find out more about this dangerous trend today, how would they obtain that help?
I would love it and welcome them to call the Identity Theft Resource Center. Our hotline is toll-free. We never ask victims or consumers for any money. You can get the information from one of our advisors by calling 888-400-5530. Or you can visit our website. We have a lot of information up now about medical identity theft, and our website is idtheftcenter.org.
That's idtheftcenter.org, and the toll-free number, once again, is 888-400-5530. Our guest today has been Eva Velasquez, the president of the Identity Theft Resource Center. And again, thank you, Eva, for joining us today, spending a few moments on this very important subject of the medical ID theft.
Thank you for allowing this. I hope it was helpful and that your listeners learned something today.
Thank you for listening to this feature, a production of BBN, the Bible Broadcasting Network. BBN provides 24-hour Christian programming, great Christian music, and Bible teaching. Listen to BBN by clicking the link in the description.